Hi everyone, my name's Katrina. I am the naturopath at Bunmark Health in the Adelaide Hills. So today I'm really lucky to have with me Isla Dommersnes, which is our myotherapist at Bunmark Health. And so today we're just going to go through a few little questions, ask Isla a little bit about herself and about myotherapy, and hopefully give you some insight into what she does in practice and what you can gain from seeing her in a treatment. So hi Isla.
Hi, how are you?
Yeah, I'm good. It's nice to talk to you this morning. Thanks so much for your time.
No worries.
So, I thought maybe let's start with just a little introduction because it's always nice to get to know the therapist. So, can you just tell us a little bit about who you are and maybe where you're from and what your practice is?
Yeah, so I studied myotherapy, a Bachelor of Health Science in Adelaide, which was a 3-year degree, given an insight into anatomy and then treatment techniques, assessment tools, and everything. Then I moved back to Mildura. I practiced for about 18 months, 2 years there, which I loved in a clinical setting, treating a lot of sports injuries, migraines, headaches, occupational injuries, and pregnancy as well. And then I decided I was ready for a change, so I moved back to Adelaide, which I'm loving.
Cool. Yep, you're back here. Awesome. And we're glad that you're back. So you can join us here in the hills. Okay, cool. So can you tell us a little bit more, I guess, about myotherapy? So what is it?
Yeah, so it's a type of manual therapy. It's quite new to South Australia. It's very common in Victoria. But what it is it's very hands-on. We do an assessment, use a lot of assessment tools similar to physio and osteopathy. To begin with in the treatment, do a bit of postural assessment, range of motion, all of those type of things to identify where the pain is stemming from. And then we will get the person on the table, treat them with a range of techniques. So we use hands-on treatment like massage, trigger point release, and then we do some techniques such as joint mobilization, dry needling, cupping, which is really handy for a lot of things. And then we also do like fascia release, and all of that, like, yeah, depending on the area of treatment. So I treat a lot of injuries, such as tennis elbow, sporting injuries, sprains, and just general muscular tightness. And then I also do a lot of like headaches, migraines, neck, shoulder pain. And then, yeah, I go into a little bit of pregnancy as well and treat a bit of sciatica, that pelvic pain that you experience during pregnancy, and that lower back pain. Yeah, it can be a really handy treatment because it's all hands on. So you get a little bit longer on the table in the treatment, which is good. So,
Yeah,
yeah.
amazing. Awesome. Sounds like you cover a lot of ground there and you've got lots of
Yeah.
different techniques. And you've said a few fancy words that maybe some people wouldn't understand,
Yeah.
including joint mobilization. Can you just explain a little bit about what that is and also fascial release?
Yeah. So, joint mobilization is like the mobilization of like your facet joints. Um, it's just moving the joint to like a minimal range of motion. It does feel really nice. It's not a manipulation as such, but
Mm,
it's a nice, slow, light movement of the joint, such as like in the lower back. Just that little bit of pressure on the spine to get things moving, increase range of motion, and just you just feel nice and loose afterwards as well. So I like to use a little bit of that after I've done muscular treatment, like all that soft tissue, good stuff.
yeah,
And then I like to finish off with that nice little bit of pressure and joint mobs at the end. So
awesome.
yeah,
Yeah, cool. And
and
fascia is that right? Fascia is kind of what keeps everything, what's
yeah.
around all of
Yeah.
everything else in there.
So, you obviously have like your skin, and then you have your fascia, and then the connective tissues,
Cool.
and then the muscle. So the fascia is what lies on top of the muscle, and that fascial release is nice to get a little bit more movement through the tissues,
Mm.
um, and loosen off the compression on the muscle belly. So it's, yeah, it's an awesome technique which I love to use as well.
Yeah, amazing. That sounds good. And you mentioned there that so injury, you treat injury. So it's okay if you've got an injury to come in, it's going to be a good option for treatment. So obviously
Yeah,
it's all individualized, right? So like you said, you do assessment at the beginning so you can see where things are coming from. Hence that little holistic kind of view myotherapy
yeah,
is in that
yeah,
you're treating the cause, not
yeah.
just covering up the symptoms or giving short-term relief.
Yeah, yeah. So we're all about that long-term relief. Getting you in the clinic, reducing your pain to a point where you might not necessarily need treatment all the time. So yeah, I like to aim at the cause of pain rather than just the symptoms. But along the way, obviously, we treat the symptoms to reduce the symptoms in the meantime. So yeah, yep. So I do treat a lot of sporting injuries. Worked with a lot of football injuries in the past. Yeah, so it's
Mm.
good.
Yeah, nice. And probably good for injury prevention too, right? So you're
Yeah,
helping the body
definitely.
stay
So
movement.
um, it's better to jump on that tight muscle before you, for instance, feel that calf pull or that hammy pull. It's just good just to get the regular muscular release in general before it turns into an injury.
Yeah, absolutely. So good for sports, but also probably good for what a lot of what I see my clients do, which is Pilates, yoga,
Yeah.
running, yeah, that kind of stuff.
Yeah, yeah. So it's just good to keep muscles loose in the meantime when you are doing all those sports and activities.
Yeah.
Yeah.
And you also did mention neck and shoulder pain. I don't know who doesn't have
Yeah, yeah.
neck and
So
shoulder pain.
I treat a lot of like headaches caused by stress, anxiety, all of that. So obviously, stress and anxiety heightens the muscle tightness in your upper body. Yeah, I love treating neck pain and headaches, migraines, jaw pain, clicking, all of that stuff as well.
Yeah, cool. And so, just lastly, a little bit more on pregnancy and postpartum. You mentioned that's part of your repertoire as well, which I think is really cool. And so we know that there, yeah, can be obviously a lot of changes in pregnancy, during pregnancy, and it's also probably nice to prep a little during preconception so that your hips and pelvis and everywhere and back and things, but just going in a little bit more smoothly and dealing with any pre-existing issues. But
Yes.
but it sounds like the kind of work that you do is great for pregnancy. And would it be okay for postpartum as well?
Yeah, definitely. So, obviously, it's important to address the issues early on in the pregnancy as well. So, I like to treat kind of like 12 weeks onwards in pregnancy, getting into those hips and the lower back, just nice and gentle treatment. Nothing crazy, but yeah, just a nice gentle treatment to reduce the hip pain, pelvic pain, just releasing those tissues through there. And yeah, it's important because obviously later in the pregnancy, sciatic pain, so like the nerve pain is very common. The pelvic pain gets more common as well due to like the hormones and the softening of the ligaments and everything. So yeah, it's nice just to get some treatment, and important to keep your muscles nice and happy during pregnancy so your body's still functioning with that growth of your baby. So yeah.
Yeah, cool. And getting ready for birth as well, I guess. It's a nice prep for that. Yeah, amazing. Cool. All right. So, just lastly, I just wanted to ask you, I guess, you already touched on what sounds like, I guess, the things you like about it, but what else, what's so special about myotherapy? What do you think is, the real key? Why did you choose that, I suppose, over anything else?
So I choose to study myotherapy because when I was in high school, I suffered from really bad migraines and headaches. I'd resorted all my options. I'd been to a physio, I'd been to a chiropractor, and I love those in complementary, but I needed more muscular treatment. I needed the more hands-on treatment where I got more hands-on treatment. So yeah, my therapist fixed my headaches and migraines. I obviously kept up the maintenance, but it was an awesome treatment, and that's what made me so passionate to study myotherapy. And yeah,
Yeah, amazing. It definitely makes a difference when it helps yourself, right? And then you want to show that to other people. And yeah, it
definitely.
sounds like It's an incredible treatment, and I've had myotherapy treatment from in the past, but also from you, which has been incredible. So I also can totally vouch for it, and I think that as a naturopath, obviously the holistic view, that's about all about that. That's that's what I want to
Yes,
advocate for. So yeah, myotherapy is right up there in the list of great options for holistic treatment. Cool. Okay.
definitely.
Well, thanks so much for your time, and it's been really nice to touch base and understand a little bit more. And if any of you have any questions for Isla, please send them
Feel
through
free
to
to
us. Yeah, cool. Through social media or send us an email, and you can book in with Isla for myotherapy. I think we're up to 3 days a week now, so check out the
yeah,
calendar.
so
Which is
Monday afternoon, there's plenty of after work hours appointments. And then Fridays and Saturdays. And if a time doesn't suit, feel free to ask. We're happy to fit you in.
Yeah, totally, and love those after hours for potentially, you've been sitting at your desk all day or just had a bad day, need some time out. Same with the weekend, maybe you can't quite fit it in, so it's nice
Yeah.
to have those on offer. Awesome. All right, thanks so much, Isla.
All
We'll
right, perfect.
catch you next time.